I'm Collins Okoyo. I'm a biostatistician and a research scientist with the Kenya Medical Research Institute in a center called Eastern and Southern Africa Center of International Parasite Control. I've been able to attend this short course on policy engagement and evidence uptake that was running early this year, and I was able to learn a lot on how to engage policymakers and how to pass my research findings to the policymakers. So I'm here to share how the concepts I've learned over the few days has been very impactful on my day-to-day research activities. So at the center where I'm working, we are concerned with advising the government through the Ministry of Health on the effective ways to control soil-transmitted helminths, schistosomiasis, among other neglected tropical diseases. So as a way to control the two parasites I've mentioned, the soil-transmitted helminths and schistosomiasis, the government has been running a national school-based deworming program for the last 5 years, 2012 to 2017, which is now in its second phase of another 5 years, 2018 to 2022. And this program has been very impactful in reducing the prevalence of soil-transmitted helminths. Apart from the school-based deworming program, other countries in the world have been watching for a community-based deworming platform. So in Kenya, there has been several studies that have been implementing the community-based deworming program, but the country has not really rolled out this community-based program as a national program. However, in 2019, there was a breaking transmission strategy that was launched by the NTD unit at the Ministry of Health to control all the NTDs using a community-based deworming platform. So since we've been working with a school-based deworming platform, there was a problem. And the problem is, how do we transition from school-based deworming program to community-based deworming program? And another problem has been, is there enough evidence to show that school-based deworming program is effective to control soil-transmitted helminths and schistosomiasis? So as a researcher, I was tasked to give the evidence that will influence the integration of school-based deworming program with the community-based deworming program. So this course has been very helpful to help me on how I could prepare to engage the policymakers so that we can find a good way of integrating the two deworming programs. And one of the things I learned very much in this course is how to map the stakeholders, who are the key people that I need to bring on board to give the evidence on how to integrate the two. And so we went on how to identify the stakeholders and putting the stakeholders in the right quadrant, like the power versus the interest that is playing along when you are mapping your stakeholders. So that was an exercise that we did, and it was very helpful for me to have used that in my undertaking of that evidence. So I want to thank the organizers of the course. That has been very helpful, and I will continue to use the concepts that I've learned with my research findings dissemination to various stakeholders. Thank you very much.